So we're going to start record, and we're on. All right, so let's open it up to any questions that you didn't email in so that we can try to cover those first. Anybody?
Dr. Connors, I have 2 questions.
Uh-huh.
First of all, when I was up there, I forgot to ask you about my dentist. I have a couple cavities. He wanted to put a root canal in. I told him no. So I have to take a shot, you know, to deaden the pain. Is there anything in that that's going to be detrimental?
Novocaine, you mean?
I'm not quite sure what it is.
Yeah, I would do that. I would not do the gas.
Okay, Novocaine.
So that's the nitrous oxide is the thing that is detrimental. It literally has been proven to just completely shut down the methionine pathway for a period of anywhere from 30 minutes to 6 hours.
Okay.
So, don't do the nitrous oxide, do a Novocaine shot.
Okay, thank you.
Shot.
Then the second question is...
Make sure you don't get mercury fillings.
No, I don't have any. No. Found out Randy has cataracts. We wanted to run the cataract program from the Rife, but it talks about a double bulb on a tripod.
Yeah, you don't need that. So just use the hammer tube. The cataract program, I'll just tell you my experience with it with other people. I've had a couple people that it was miraculous, and then and that was probably 20% of the people, and then 80% were like, I didn't notice anything different.
Oh.
But give it a shot. Okay,
thanks.
I had one person last summer cancel their surgery.
Oh.
And that was that miraculous. So give it a try.
Okay, thanks.
Anybody else? Okay, so let's jump into this and get to some questions that people have asked. First of all, a couple comments. I know a number of you ordered the IV gene test. That's fantastic. We're gonna get results back soon because I talked to the lab and they told me that some kits have come in. It takes about 5 business days to get the results back right now. I know they have done some marketing. There's a local fire station. You'll see a video if you go on the IVD Gene website that is doing all the firemen, and I think they're giving them a discount or something like that, or the fire department's paying for the tests for all the firemen, which is really nice because firemen have an increased incidence of cancer, probably due to all the smoke and garbage that they breathe in, you know, even in their practice runs and such. So that's really cool. So the information about the IV gene test, that was on a local television station interview. The information on the IV gene test is going to become more and more popular, and it's probably going to become more mainstream. Again, it's probably going to take a while before it becomes mainstream medicine and replace a lot of biopsies, but we're at the cutting edge of that, so it's going to be neat. So we'll go over those results. When I get those results in, I will inform you. We'll set up a time to go over those. I'll be going over those with everybody who does that test. Okay, to your questions. One person asked, I was wondering if removing a tumor would spread the cancer. So, phenomenal question. Is it wise to remove cancer surgically? Can that cause the tumor to spread? So the answer is not as cut and dry as we would like it to be. So removing a cancerous tumor surgically is called debulking the cancer. You're removing as much as you can see. Remember, cells are microscopic. You can't see the cells. So they're removing the mass that is visual. So I'll give you an example. So I'm gonna mute people here because I'm getting some feedback. So I'll give you an example. When you have a cancer that is a skin cancer. I've had multiple people with melanoma, and we use a black salve typically on a melanoma. The melanoma may be the size of a centimeter in diameter. And you put the black salve on it, it opens up that skin around it, and it starts to eat away the cancer. And I've had patients where it was the size of a centimeter in diameter, and it opened up to about 8 centimeters um, by about 5 centimeters, kind of egg-shaped, by about a centimeter and a half to 2 centimeters deep. Now, there's no way visually that you would have been able to see that as cancer if they went in and did surgery. On a melanoma, the surgery for a melanoma or a skin cancer is called Mohs surgery, named after the surgeon who came up with that idea. And they would go and they would take that, what they could see visually. So in the case of somebody's visual melanoma, that mole being a centimeter in diameter, they would have cut out a little bit larger than a centimeter, removed it, sent it to the lab, and they would have the borders checked. If the borders were clean up to 3 millimeters, they'd say they're not clean borders, and they'd go back and go deeper, thinking that they're just cutting out good, healthy tissue, but they know there's still cancer there, so they'd go deeper. In the case of the melanoma being 7 centimeters by 3 centimeters, they would probably remove a large portion of that person's body where that melanoma was found before they would have quote unquote clean borders, because they can't visually see where the cancer is. They're only seeing the external sign of the cancer. That being said, is it wise to remove a melanoma? Well, not really, because melanoma can spread very rapidly. Now, other tumors like an esophageal tumor or a colon cancer tumor or a breast tumor, is it wise to remove the tumor? The answer is sometimes it can be. So they can remove what they can see, and you're getting a large bulk of the tumor out of there. However, that being said, when you go in and surgically remove the tumor, you're disrupting the tumor bed, which can be a bad thing, because you could actually cause it to take off. And the reason why you would cause it to take off is the way that your body has to heal any wound like that. You're surgically removing a piece of the cancer. The way your body has to heal it is it has to upregulate that pathway that we talk about all the time, that mTOR pathway. So it stimulates IGF-1 production, which is growth factor, because that's how you have to heal that wound. And if you still have cancer cells there left, you are basically throwing IGF-1 on a cancer that's there. Now, that being said, that sounds scary. That means, oh my gosh, well, I'm not going to go do that. However, you have to balance it out with if I have an esophageal cancer that's blocking my throat and I can't swallow anymore, then it might be at a point where it's best to surgically remove that. So you have to make a clinical decision there. I think it's always best to try to treat it more conservatively first, do everything we possibly can to shrink that. So let's say if it's an esophageal tumor and I have very distinct symptoms, meaning a very difficult time swallowing, and I'm treating it conservatively, and my swallowing is getting worse and worse and worse and worse, not just from something insidious for a few days, but it's continually getting worse over weeks, then I may have to go in there and surgically remove it. But if it's like, wow, it's not getting any worse, the next week, maybe it's even a little bit better, then I would postpone that idea. Also, you can scope it, and you can go down there with a scope and you can look at it, and the doctor can say, well, I think it's about the same size as it was, but remember, he's going to have a bias, so you got to deal with that little bias as well. So that being said, I wish there was a more perfect answer with that, but there isn't. You have to go by your symptoms, by testing that's being done. Let's say it's a scope or a CT scan or an MRI or an ultrasound to see how the cancer, if it's getting better or if it's getting worse. So there's not a perfect answer there. In general, though, is it wise to surgically remove a cancer? I think it's unwise to surgically remove a cancer as your first line of defense. I think you should do conservative things first to see if you can shrink it, and then we'll remove it if we have to. Same thing with a breast tumor. I have this marble-sized breast tumor. Let's say you start with a conservative approach. You're doing a lot of alternative things, and in 3 months it's a golf ball size. In another 3 months it's getting bigger. Okay, we have to do something different. So you don't just stick your head in the sand and pretend it's going to go away. If what you're doing isn't working, then you have to change it up, whether you're changing up your alternative approach or whether you're going to add some standard oncology along with it. That's where, again, I'm not against standard oncology, I'm just against unwise use of it. So we want to take each case as an individual case and not make a blanket statement here. So I know the person who asked me that question. If you feel like you're getting worse or this is getting worse, we need to talk again. We need to have another sit down and say, okay, maybe we need to do another scope. Maybe we need to consider this again. But we want to make every conservative effort prior to just jumping down that pathway. Next question. Is it true that Wi-Fi exposure can damage the eggs of our daughters and subsequently cause birth defects in our children? Because I read about this, and that could cause defects, genetic defects that then we pass on to our children. Well, there isn't any hard evidence, and if you went and searched for studies that Wi-Fi exposure damaged the eggs or the sperm cells or damaged the genes, and then you passed on those genetic defects to our children, you wouldn't find any research. There isn't any research on it. So I can't say that that is true. However, I can say that, let's just be reasonable about this, is our continued exposure to EMFs, not just EMFs from Wi-Fi, but from cell phone towers and our cell phones and our dirty electricity in our house and et cetera, is that damaging our genes? My belief is, yeah, probably. So we do want to be wise about trying to mitigate that as much as possible, but also we have to. I had somebody in the other day saying that they did some things to their house and they disconnected their Wi-Fi so they don't have any EMFs. Well, yeah, good luck with that. You have EMFs in your house. So there's no such thing as not having EMFs fly. If you can still turn on a little transistor, $5 transistor radio and go search stations and pick up stations, you have radio waves flying through the air. That transistor radio is simply a receiver. It's receiving the waves that are already there. So those waves are going through you. If you can pick up your cell phone and you can make calls outside to someone from your house, you are receiving EMFs, waves from cell phone towers in your house. So only if you moved to a place where you could not use your cell phone, you had no radio frequencies, it would have to be a deserted island somewhere, would you probably be free of the majority of EMF exposure. So you can run, but you cannot hide. There's things that you want to do to mitigate exposure. Maybe, hey, would it be beneficial to turn off our Wi-Fi at night? Good idea. Maybe it'd be a good idea to not have our cell phones charging right by our bedside at night. Good idea. So there are some things that you can do. It's a matter of, I also don't want people living in fear either. So here's a comment. I want to jump in on these comments, so I don't want to miss it. Would it be helpful to get an acupuncture bulb to focus on the tumor of the previous question? I think that was. That's possible. So there are other bulbs. There's a spiral bulb. There is a bulb that is that you can use for acupuncture points. I think you've seen that in my office. I had it on my Rife when most of you were here in my office. That can be used for facials, that can be used to focus more directly on the tumor. That is another possibility to use. Contact my office and we can get that for you, or you can order it directly from TrueRife, but we'll point you in the right direction. So those are good comments that are other possible things to do. But back to the Wi-Fi question now. So what do? You try to decrease your exposure. The problem is that you go out in public, there's Wi-Fi everywhere. There's EMFs everywhere. It's difficult to do that. You can do what you can do at home. I think the biggest exposure of EMFs, of dangerous EMFs, is the cell phone towers. The closer you live to a cell phone tower, the more exposure you're going to have. But that's difficult to get away from unless you move somewhere. But I was in a group of doctors a couple of years ago that was secretly grounding cell phone towers by using some volcanic ash to spread around different cell phone towers and using grounding spikes to ground cell phone towers. The problem is they just put out so much EMS, I just don't know how valuable that was. There's other ways to help ground your house. You can call the office and talk to Michelle about that. She and I used to go to local people's houses and ground their house with a volcanic ash to spread around their house. And I think there's benefit to that. I've done that to my house. We use the EMF shields at our house, the ones that we talked about on a special video that I interviewed the gentleman from the company that we use. And I think those have benefit. But in truth, nothing is going to get rid of all your EMFs. You just do what you can. Next question. I was reading some of the Rife programs, which I love to do. And I was reading that all the EBV programs, now for those who don't know, that's Epstein Barr virus programs. And I know the person who sent me this, and he also sent me a link to a practitioner who did some conference calls. They were like, they weren't video calls, but they were audio sessions on his belief that Epstein-Barr is a big cause of a lot of things, including cancers, including a lot of our problems that we have. It's tied to a lot of Lyme disease, and it's hard to argue with that. Epstein-Barr, back in the 70s, 80s, when it became more well known, was tied to chronic fatigue syndrome. And many of us can have subclinical Epstein-Barr virus and have symptoms of it and never be diagnosed with Epstein-Barr. So typically Epstein-Barr virus is diagnosed on a blood test. However, it's only going to show up on a blood test if it's circulating in the blood at the time of the test. So there's so many people will have false negatives that you're probably better off not even trying to test for it, but to run some of the Rife programs for it. The difficulty in treating Epstein-Barr virus is that it's a virus. Viruses are different than bacteria. It's hard to kill them with herbs. That's one of the reasons why I like berberine so much, because berberine works very well for Epstein-Barr virus. So does grapefruit seed extract. Those are my two favorites for Epstein-Barr virus. However, the Rife is one of the best tools for this. So this person was writing, I read all the Epstein-Barr virus programs to see if they were different. I noticed in one program, there's comments in the programs, and the comments were by different practitioners like me that used it on different people, and Mike that has done research on this, Mike from TrueRife. And one of the comments said that taking steroids for 5 days actually had some long-term benefits for treating Epstein-Barr virus. Now, I was taken back by this, that I felt that most holistic health people think that steroids are bad. Well, yes, I would agree that I'm not a fan of long-term steroid use, because what steroids do is they decrease inflammation. Well, that's a good thing, but they decrease inflammation by shutting down your immune system. So so inflammation is a two-sided coin. So we don't want long-term chronic inflammation. That's what's unhealthy for us. And that's what having a subclinical disorder like Epstein-Barr virus does to us. It gives us long-standing chronic subclinical inflammation that then blocks a lot of metabolic pathways and can lead to diseases like cancer and chronic fatigue, and can make Lyme worse, and can make a whole bunch of other things worse. So Epstein-Barr virus, H. pylori fits into that category. Chlamydia pneumonia fits into this category. Diseases that nobody ever gets diagnosed with, but they can lead to problems. And this is what I've said about cardio problems. Cardiovascular diseases on postmortem studies were found to be caused by inflammation in the endothelial tissue caused from undiagnosed chronic Lyme, undiagnosed H. pylori, Epstein-Barr, chlamydia, pneumonia, and heavy metal toxicity. So Epstein-Barr virus is definitely a player in so many chronic diseases because it causes this subclinical chronic inflammation. That's where short-term steroid use, but you could also say you could use some natural anti-inflammatories the same way. So short-term steroid use in treating a really bad case of Epstein-Barr can really help knock down the inflammation. So whatever you're doing to treat the Epstein-Barr can get at the Epstein-Barr to help kill it. So I'm not against short-term steroid use, especially in life-threatening conditions, or I have this chronic inflammation and I can hardly breathe. Use a steroid inhaler for a short period of time can get you over it. And when I was dealing with my mercury toxicity, if I did not have that, literally I wouldn't be sitting here talking to you because I would have been dead. So I'm thankful for medication in short-term use. Long-term steroid use decreases white blood cell counts and can be a major cause of cancer. So we don't want to do that. But short-term steroid use can be beneficial for different things. However, you could also use things that are steroid-like in the natural world, like boswellia, curcumin, ginger, those kind of anti-inflammatories that can decrease that chronic inflammation, so that the effect of using the Rife is going to be more beneficial and be able to hit that Epstein-Barr virus. So a lot of words to explain that. Yes, I agree with this practitioner's comment that sometimes short-term steroid can have its benefits, especially when you're dealing with something that causes chronic inflammation. Does that lead to any questions before we get to the final question? Okay, final question of the day. I am using the DMSO zinc spray on my breast tumor. I understand about the DMSO and that it penetrates and delivers the zinc rapidly, but why zinc? And can I use it on a cyst elsewhere in my body? And when is it too much or too long of use? So the reason why zinc, I actually am in the middle of writing a paper on this. I actually sent did I send a paper? No, I sent a paper on copper to Cancer Tutor that they're going to publish, but they sent me back a reply that, thank you for this wonderful article. It's too technical. Can you please make it less technical so people can understand? And I do apologize for some of my writings and probably some of my talks that I'm not a great teacher in dumbing down the information to make it more applicable and understandable. So I will make a better effort to do that. But zinc, why zinc? Zinc has been shown through numerous studies that zinc penetrated into a cancer can help shut down the replication cycle. Zinc has been shown through studies to be deficient in cancers, and in other studies where they injected zinc into mouse model cancers to in vivo mouse models where it shrunk the tumors and killed the tumors. So again, I bring it back to the reason why I got this idea to do that was simply because of a seminar that I went to in December where the practitioner, one of the practitioners who was speaking came up to me later and told me about a case where he had a patient with uncontrollable growth of stage 4 metastatic prostate cancer, and he sent him overseas, I think to Italy, to a doctor who was experimenting with injecting cancers with certain substances, and he said, hey, would you try injecting this guy's cancer with zinc? And he said, sure. Now, this doctor is a licensed medical doctor, so if he did something like that, he would get in trouble. Now, I'm not a licensed medical doctor, so we could do this. And that's one of the things that we are going to do in the near future is more injections and IV therapies. But that's for another talk. So I thought, well, how else am I going to get zinc into a tumor? Because they found that taking it orally can be beneficial, but it's not rapidly uptake by the tumor itself. So how else are we going to get into the tumor? And I thought, well, heck, let's just use some DMSO because that will drive it in. And so far, it's been working well on a large percentage of people that are doing it. So I'm excited about that. Now, I'm going to be more excited when we even have more feedback on this, and when we try to do some injectables and such of zinc, we're hoping that we're going to get even greater results. Now, again, it's just like anything else. Nothing is going to be perfect on every person. So, but it's certainly harmless, because can you use this on a cyst anywhere else in your body? Sure. Is it going to work? I don't know. And is too much of it bad for you? No. I mean, is there a toxic level of zinc? Yes. There's not enough in that whole bottle of spray, if you dump that whole thing on you and smeared it all over your body, to make you toxic level of zinc. So that's not really possible with the delivery system that you have there to maintain it, to have a toxic level. So don't worry about that. So again, on the bottle, it says 1 to 3 sprays a day. I've been telling everybody do more than that. So don't spray it in your eyes. Don't spray it, in your mouth, even though you could. Some people take DMSO orally, but I don't. But just continue to use it topically, and you'll be fine. 5 to 6 to 8 times a day is no problem, and you can use it on multiple areas. Do you massage it in? Yeah, you do. It's watery, but there is a little bit of viscosity to it. So you can massage it in so it doesn't just run off. Sure, yep, absolutely. Especially if you're a male and you're hairy, and you kind of want to get it to the skin. If you're a female and you're hairy, you want to get it to the skin too. So. Any questions does that bring up? No? No questions? I know the person that asked this question also had a question about EMFs and their meter. I'd like to address that separately on a different call, and I'd really like to get Amity Erickson to help address that too. So I didn't add that question to this, so we'll get that in another call. I'm trying to update my Rife programs. Is there a link to help me facilitate this? Okay, so good question. Maybe I better unmute everybody here. So how do I update my Rife programs? It's super easy. So you have to be connected to the internet. Your Rife computer has to be connected to the internet. If your Rife computer is not connected to the internet, then you can't update your programs. If you're connected to the internet, then all you do is open up any program on your Rife, And there's a little button on the top that says update frequencies. Click on that. It will go through its cycle. It will update the frequencies. I think it'll ask you a question that you have to say yes to, and just follow the little prompts, and it'll take a couple minutes, and it'll all be updated. And it will not change any programs that I created for you, but it'll update everything. So it's super easy to do. I think you should do that about once. I used to tell people once every 6 months. Mike's giving a few more updates, especially around flu time, because he gave an update on uh, the new flu that's going around. So yeah, it's super, super easy to do. Any other questions? All right, so we will end our chat today. I do want to remind everybody that Dr. Halderman is joining our practice. We had very few comments about that. I don't know if everybody's like scared about that or that they won't be able to talk to me or anymore or anything. That's not going to happen, so don't worry about that. It's just I need some extra help. Dr. Halderman worked with me several years ago. She left when she was pregnant with her third child, and now she wants to be back working again. And I am just thrilled to death that she's coming back with us. We are kindred spirits. She is very much like me in that she's just addicted to knowledge. She is an expert in genetics. She's the only other person that I would trust going over my genetics for me. So you have to know that I would never trust anybody that I didn't think was top notch with any of my patients. So that's Dr. Kelly Halderman. She's going to be on the schedule starting February 12th, which is coming up very soon. Oh my gosh, tomorrow's February 1st. So we're really super excited about that. Mike asks, did the genetic stuff come in? Meaning, did the new genetic test come in? Sorry, it did not. So it is going to be done through the University of Miami. That's all I know. And the test is going to run about $185. So it's even going to be cheaper than 23andMe. And it's going to be testing 900,000 SNPs, which is about 750,000 more than 23andMe did. So it's going to be, it's a long time waiting for this, but it's going to be well worth the wait. So we're very excited about that. And any other questions?
Dr. Connors?
Uh-huh.
I had my IV gene test done today. The blood was drawn today. About how long does that take to get back? Do you know?
So it takes about 5 working days.
Oh, okay.
So about 5 business days, I should say. And as soon as we get it back, I get an email. You don't. And
Okay.
I will, the office will call you and schedule time to talk.
Okay, great. Thank you.
And then we'll forward that. So I will also be doing another video that I'll post on the Facebook on the IV gene so that I'm not re-explaining myself every time I talk to everybody that did the IV gene. So it just reminds them what we're looking for on the IV gene, what is a positive score, and what our purpose for it is. So I'll be doing that at no later than this weekend. I'll have it up on Facebook. So everybody that is doing the IV gene or thinking about it or has done it will want to watch that video before we get their test back. I did talk to IV gene yesterday. I think they got 6 of my kits in from my patients yesterday and a couple more today. So by next week, we'll be getting some results on those.
All right, thank you.
All right, thanks everybody.
Thank you.
You guys have a great night.
Thank you.
Bye.
Bye.
Bye.